So PCOS patients, which are a very common, PCO is very prevalent in most societies, and so we deal with this regularly in the clinic with a high percentage of our patients coming in with PCO. And we know that the average PCO patient, while we can retrieve many oocytes from them because they have enhanced follicular development due to changes in the steroid metabolism, basically, within the follicle, we know that even though there are more follicles to retrieve, that these eggs do not perform well after fertilization and early development. And there's a growing literature that raises the specific concern with PCOS patients that because of their high endogenous androgen levels, that the exposure of oocytes in PCO patients' follicles may lead to offspring defects, mainly having to do with ovarian development in the offspring. So again, are there options emerging that we can begin to consider for management of oocyte quality in PCO patients? The answer is yes. I think at this meeting especially, but more broadly, we're seeing the introduction of in vitro maturation coupled with low follicular stimulation to achieve two goals. The first is that PCO patients are also prone to ovarian hyperstimulation syndrome under conventional stimulation protocols. So by minimizing stimulation, we reduce the risk of OHSS. But more importantly, at the level of the oocytes we're retrieving, with or without a trigger, the oocytes we're retrieving have resided in follicles that have endogenous concentrations of androgens that are simply too high. And so the use of IVM now allows us to retrieve those oocytes from, again, minimal stim cycles, put them into media, which gives the oocytes and the cumulus cells around the oocytes a chance to recover from that abnormal follicular environment that they had resided in. And most of the research is pointing to the fact that these oocytes will, in fact, readjust their metabolism. They'll readjust the nature of the metabolic support that they get from the cumulus cells and result in higher quality cytoplasmic maturity, which we know is directly linked to improved embryo quality, improved pregnancy rates, and as you bring up in your question, hopefully will reduce the incidence of any birth defects or secondary complications that the offspring from these patients have shown in the past.